I'm Dr. Stafford. My dental office is Stafford Smiles in Happy Valley. I'd like to talk to you about sleep apnea. So you may not have heard that term and wonder, what is sleep apnea? Sleep apnea is simply a blockage of the airway that occurs at night, so that you're not allowed to get a full breath. People who have sleep apnea have many symptoms. The most common symptom is fatigue, because a person who has sleep apnea is not getting rest at night. The reason is because when the oxygen supply is cut down in the body, the brain has to make a decision, either to allow the person to sleep or to wake the person up to breathe. Both are important, both sleep and oxygen. And when the oxygen level in the blood, because of the blockage, gets low enough, finally the brain says, we've had enough, we got to wake up and get some air. So a person that's affected with sleep apnea will find themselves waking up many times during the night, sometimes as often as 40 or 50 times per hour. So that person wakes up in the morning not rested from a good night's sleep, but exhausted from struggling all night to get air. Other consequences of sleep apnea are symptoms that you may have thought came from some other source. High blood pressure, cardiovascular disease, stroke, diabetes, all can be consequences of sleep apnea. If a person has sleep apnea, they probably would only be aware of the symptoms of fatigue, or their sleeping partner might be aware of their struggle during the night, their gasping, their snoring, their restlessness. Either way, it's important, if you identify the possibility that you have sleep apnea, to get diagnosed and get treated, because of the serious consequences of not treating sleep apnea. Diagnosis consists of a test, either a sleep test at a sleep center or a take-home test that you can do at home. Once sleep apnea is diagnosed, there's a couple of ways to treat it. Serious sleep apnea involves a device called a continuous positive air pressure device that provides air pressure, positive air pressure, to the airway to keep it open. The other option is a dental device that repositions the jaw and provides an open airway that way. So you may be asking yourself, why is a dentist talking about sleep apnea? This is usually something that physicians do, and that's true. But what I'm concerned about is, from my own experience, I am a victim of sleep apnea. I'm a sleep apnea patient. I have severe sleep apnea. I came from a family of physicians. I get regular medical checkups, and nobody ever discussed it with me until I learned about sleep apnea myself. So I'm concerned about making sure that people know about sleep apnea as a disease, know the consequences of sleep apnea, and know what the options are for treatment. So the treatment may be provided in a dental office, or it may be provided by a sleep specialist. So if you suspect that either you or your partner have sleep apnea, I would encourage you to talk to your medical provider, talk to a dentist, talk to me. We'd be glad to provide you with a screening test that can give you a very accurate idea of whether or not you have sleep apnea, and then can direct you to the proper place to get treatment. For more information or a free consultation, contact our office today.